Hello everyone. Today I'll be taking another VivaLive session with QQSphere on the topic of pharmacology, uh, general pharmacology to be precise, and with the subtopic first pass effect from pharmacokinetics. Let's start.
Welcome to the pharmacology examination. Let's start with a foundational concept. Please define bioavailability and explain how it is influenced by the first pass effect.
The fraction of an administered drug that reaches systemic circulation in an unchanged form is called bioavailability. Uh, it Oral bioavailability is typically less than 100% due to incomplete absorption and first pass metabolism, which is essentially which reduces the oral drug concentration via hepatic metabolism.
That's correct. Now, considering that impact, what physiological factors can cause significant variations in this first pass metabolism between individuals?
Alternative routes can be intravenous, transdermal, nasal, or sublingual to bypass this effect. It reduces the concentration of the active drug.
You've mentioned methods to bypass it, which is good, but my question was about what physiological factors cause the variation in how effectively the first pass metabolism works. Can you tell me about enzyme activity, liver function, or blood flow to the liver?
Yes. The hepatic blood flow, genetic variations in metabolic enzymes like CYP450, and drug properties are the physiological factors affecting first pass metabolism. It is also affected by the route of administration, hepatic blood flow, liver disease and health, and enzymatic activity, which is based on genetics. Drug interaction and food and diet and drug formulation are also some factors.
Excellent. You've covered the key factors. Now, can you give me an example of a drug with a very high first pass metabolism and discuss how that affects dosing?
Uh, can you please answer this?
My role is to assess your understanding, not provide the answers for you. Think back to common drugs you might have studied, perhaps one that is used for heart conditions or pain management. Can you recall any with a low oral dose compared to intravenous?
Drugs like propranolol, morphine, lidocaine, nitroglycerin, and verapamil.
Yes, those are perfect examples. Focusing on nitroglycerin, how does its high first pass metabolism influence the way it's administered for immediate relief and why?
I don't know.
Nitroglycerin has a very high first pass effect, meaning most of it is destroyed by the liver before it can reach the bloodstream when taken orally. To bypass this, it's commonly administered sublingually under the tongue, so it's absorbed directly into the systemic circulation, providing rapid relief. Now, let's shift gears slightly. What is the concept of drug antagonism, and can you give me a specific type?
Yes, drug antagonism occurs when one drug reduces or inhibits the effect of another substance by blocking its action at the receptor, neutralizing it, or producing an opposite physiological effect.
That's quite comprehensive. You mentioned blocking at the receptor. Can you differentiate between competitive and non competitive antagonism for me?
Yes, competitive, which is also reversible antagonism. The antagonist competes with the agonist for the same receptor site, whereas in non-competitive antagonism, which is irreversible, the antagonist binds to a different site or binds irreversibly to the active site, reducing the maximum potential effect of the agonist.
That's exactly right. You've demonstrated good understanding of these principles. Now, for a clinical scenario. If a drug has a very narrow therapeutic